This was a symposium that was focused on the role of proteasome inhibitors in the field of multiple myeloma. And this is quite exciting because proteasome inhibitors is a very interesting family that can be very useful in cancer, especially in multiple myeloma. And for the last 15 years, we have lived with the first generation proteasome inhibitor, namely Bortezomib. Now we have the introduction into the field of second generation proteasome inhibitors, namely Carfilzomib, but also oral proteasome inhibitors like Ixazomib. So the session was structured first on some mechanistic aspects related to the role of proteasome inhibitors in this field. Then we debated and discussed with the different speakers about the role of the different combinations in the treatment of relapse or refractory myeloma, with this debate between doublet versus triplet combinations. And we had an update about the results of the most recent trials in this field. So we had the results of the ASPIRE trial that were presented showing the superiority of a triplet combination, Carfilzomib, Lenalidomide, Dexamethasone compared to Lenalidomide, Dexamethasone in terms of PFS in relapsed refractory patients. We also have seen the results of Ixazomib, Lenalidomide, Dexamethasone versus Lenalidomide, Dexamethasone, and finally the results of the doublet study showing the role of Carfilzomib, Dexamethasone versus Bortezomib, Dexamethasone, second generation versus first generation. And some important issues that were discussed during these different talks were related to the value of these drugs in high-risk cytogenetics, because it is likely that second-generation proteasome inhibitors are capable of providing some additional efficacy in these very hard-to-treat patients.